So tell me this, Dr. Williams, what is the difference between when I first came to you 16 years ago than it is now?
The difference is 16 years ago, we could not do the genetics of the tumor, and just about every cancer is probably going to be treated with immunotherapy alone, or more likely immunotherapy in combination with drugs, ideally selected drugs, and with radiation. You put the three together, people live longer.
I'm a chef, and I was at work doing an event. We were plating up this event, and I told one of my coworkers, I said, look, I feel like I'm about to pass out. And out came 4 or 5 big blood clots. I mean, the size was like balls. When I woke up, I was in an ambulance, and I'm like, what happened? It's like, well, we were taken to the hospital. You passed out, you still have these blood clots. Well, moving right along, I get there, and they said I had a bleeding ulcer. So they did surgery on that. And then they found out that there was cancer. And that's when I was instructed to come see Dr. Williams. First time I met him, he talked to me like I was a human being. And so welcoming with letting me know what I had to go through, what I had to expect. And we've been together ever since. It's been 16 years, and he's treated 4 of my cancers.
If your immune system is messed up, you could get a hole in the repertoire of what you can react against. And that could include viruses or cancers. And I was studying those very cells in my laboratory in Boston. So I would get all these blood samples. 100% of them had low CD4 cell count, an abnormal ratio of the CD4 cells to the CD8 cells, and normal or elevated immunoglobulin G. That's the antibodies. I've been studying in California breast cancer patients. That set of abnormalities turned out to show up in more than expected numbers in my cancer patients. That defines a new disease, acquired immune deficiency syndrome / cancer. Michael had an AIDS-defining disease that wasn't HIV. He does have HIV, but the AIDS-defining diseases he had were cancers.
In this case, we're talking about 2 kinds of cells that are probably important in your disease. The T cells and the NK cells. Because the possibility exists that the reason why you don't have infection and you are surviving cancer is due to the same mechanism, a combination of T cells, CD4, CD8, and the NK cells.
Dr. Yunis discovered how they're turned off and how they work.
Right.
And what they attack. Your cancer wasn't a piece of stomach. Right. It was your stomach cancer.
And that's the way you always made me feel, like I was your only patient. I mean, it's like you're always there. You always take time up to explain. If I got questions, you answer them. Well, I feel grateful and quite blessed to have you as my oncologist, and I think you've done wonders.
Congratulations, my friend.